When it comes to stretching your hip flexor, a classic that gets recommended is this couch stretch, and that it's the best stretch for the psoas. However, that really isn't the case. We are going to go through the anatomy of the hip flexor to explain why, and the proper, better way to stretch it. Hi, my name's Rob from AMR Physio, and if you do this stretch, you'll definitely feel it working, but it might not be the area you're wanting to target. The need for hip flexor stretching gets pushed in this day and age due to people spending so much more time in sitting positions without doing much physical activity, and the potential of leading to lower cross syndrome. A slightly debated condition, but it's basically where hip flexors and the lower back become tight while the abs and the glutes are weak. And this tightness will bring the back more into extension because the psoas attaches into that lower back. If we look at the hip flexor anatomy, the prime movers for this are the psoas. So this attaches into the lumbar spine to the top of the femur on the lesser trochanter. And a lot of the time, this gets blamed for a lot of people's back pain. Again, debated and not for this video, but you can imagine it's attaching into the back. People are sitting a lot. There is an argument for it. The other is the iliacus muscle that goes from the ilium to the top of the femur again on that lesser trochanter. These commonly get grouped together and called the iliopsoas. Now, this stretch is often touted and pushed as the best stretch for these muscles, especially if one to stretch more due to back pain. However, it really isn't and could actually cause you to stretch them less. Let me explain. First off, for these muscles, why would bending the knee increase the stretch on these when they have zero attachment at the knee? What this will do is increase the stretch of other muscles, mainly rectus femoris and likely sartorius, and these muscles help with hip flexion but aren't the prime movers. But the main difference with these ones is that they also cross the knee. So what you're doing when you put the knee into really deep flexion is increase the stretch at the knee end for these muscles, and then going into hip extension increases stretch on the other end. So a really great stretch for those muscles. However, now you have a situation where the amount of stretch you are getting to is limited to that of the rectus femoris and sartorius, whereas the iliopsoas could have gone into a deeper stretch but now can't because those others are maxed out due to the increased knee bend. So by all means do this stretch, but make sure you're also doing different ones to hit the iliopsoas better. And this doesn't have to be complicated. To do this, you definitely want to be getting the hip into extension, but you don't have to worry about bending the knee. So that will start bringing a stretch in the distal end. To increase this though, you want to get a stretch at that proximal end at the lumbar spine. This is a very subtle movement, but you'll feel it when you get it right. So if targeting the psoas, you want to be moving the lumbar spine. However, what you don't want to be doing is going into extension here, which is what you see a lot when stretching hip flexors. However, that's just recreating that lower cross syndrome position and issue, which is actually a shortening of the hip flexors. You also don't want to be going into full flexion, as that won't get it either, but almost trying to move the spine backwards. The best way to help this is moving more into a posterior pelvic tilt, trying to activate some of those deeper ab muscles to help, and move it away. Have a play about with the position until you can feel a better stretch here. So don't completely ignore that couch stretch because it has its place and a great stretch for the rectus femoris, but it definitely isn't the best iliopsoas hip flexor stretch. You don't need to worry about knee bending when stretching the iliopsoas. I hope you found this useful. We have a similar video here showing how most people are stretching the hamstring wrong and a better way to do it. Also, subscribe for more and let us know any other areas you're interested in us covering in the comments.